Finding out you or a loved one has Alzheimer's disease can raise a lot of questions and concerns.
It's a hard thing to face, but it's always important to get help early.
That's because treatment might make a difference how quickly the disease progresses.
Can you tell me how your summer was?
Good. Real good.
This is a guide for Alzheimer's patients and their families looking toward an uncertain future. You'll discover there's a lot you can do to get the most out of this time together.
Education is a very important part of the whole Alzheimer's disease process. Trying to maximize the quality of life for an individual should really be a goal of all of us as we care for people with Alzheimer's disease.
Leah Thompson is an actress, a dancer, and a singer. She has performed steadily ever since playing Lorraine McFly in the blockbuster Back to the Future movies. But most of all, she cherishes her family life.
Well, my favorite role is mother. Really, honestly. I've been really lucky that, that I've been just famous enough to work and do good work and get a good table at a restaurant and not so famous that, paparazzi is torturing me and my kids. So I've just been the luckiest girl ever.
Leah also makes time to volunteer on behalf of Alzheimer's disease awareness and research. Leah's family has been touched by this illness again and again. You'll be hearing more about her story in this program. You'll also hear from patients, their loved ones, and the doctors who are guiding their care, because the first step on the journey is learning about the road ahead.
Understanding Alzheimer's is something that most people never thought they would need. But once you realize that you're living with it in a family member, knowing what you're going to face next can really help, can forestall major problems, can make the change in living situation, the change in interpersonal relationships much more manageable if you know what you're dealing with.
Alzheimer's disease is the most common cause of memory loss and other problems with thinking called cognitive impairment. In the United States, it affects almost 1 in 10 people over the age of 71. But it's not a normal part of aging.
Many of us will develop some forgetfulness as we age, but the degree to which people with Alzheimer's disease forget and are cognitively impaired is beyond what we would expect for normal.
Millions of Americans now live with Alzheimer's disease. There is no cure, and the illness does get worse over time. But there are treatments that are available that may help slow the progression of the symptoms of the disease that affect thinking, memory, and speaking skills.
So hopefully, especially when the diagnosis is made in an early stage, the patient can continue many of the activities that they previously enjoyed and participated in, and there can be many things that the family can still do together that provide enjoyment and quality of life for everybody. How are you doing today?
Dwayne is in his late 70s, and this is an especially important factor in people with Alzheimer's. 9 out of 10 people with the disease are over 60.
The cause of Alzheimer's disease is not exactly known, but there certainly are some well-known contributing factors, one of them being family history and the other being age.
When people under 60 get the disease, they might have inherited genes that increase their risk. Genes could play a role in older people too, but so might other factors such as having type 2 diabetes, heart disease, or high blood pressure.
So it's more complicated in older people than it is in younger people.
No matter what the root cause is, Alzheimer's disease occurs because brain cells slowly die. Parts of the brain shrink and stop working. New methods of testing for Alzheimer's disease are being developed. But for now, the diagnosis begins with a conversation at the doctor's office.
Generally speaking, the first clue that Alzheimer's disease may be on the horizon is forgetfulness.
Oh, that's a big one. Oh.
But it goes beyond the incidental forgetfulness that might come with aging. With Alzheimer's disease, memory changes can be disruptive to daily life.
Another good one.
And what have you seen in the last few
I'm
months?
seeing a gradual diminishing of his powers to follow directions. Go downstairs, pick up the basket, bring it up to me. He goes downstairs, he finds an old map of Europe and starts studying it and comes up and says, "Do you know we were there in '82? Where's the basket? What basket?" I mean,
Someone with Alzheimer's disease might forget important dates or ask for the same information repeatedly.
And importantly, people around them, their family and friends, start to notice that the person is now forgetting information that he or she formerly remembered quite easily.
In addition to memory changes, other warning signs may include challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, vision difficulties, and new problems understanding or expressing words.
I think one of the things that I've heard is that if you don't remember where your purse is, that's one thing, but if you don't remember what a purse is, that's a bad sign.
Other warning signs could include misplacing things and losing the ability to retrace steps, poor judgment, not paying attention to personal grooming, withdrawal from work or social activities, or mood or personality changes. Of course, often it's not the patient who notices these changes. It's up to loved ones to take action.
It sometimes can be difficult to get people to come in to see the doctor for their forgetfulness or their memory problems. It sometimes is helpful to say, why don't we just go in and have the doctor give you an overall checkup? In the course of that evaluation, then, the physician ought to evaluate the mental status of the person to see if there might be a pending cognitive problem, which could be the earliest signs of Alzheimer's disease.
It was at a routine checkup many years ago that Art was referred to a neurologist, a doctor who specializes in disorders of the brain.
So how has your memory been going, say, in the last 6 to 8 months or so?
Art's wife, Nancy, has an important role as both caregiver and observer. In fact, family members are often consulted as the diagnosis is made.
Well, can I ask Greg some questions?
Oh, sure.
How's your dad done over the last few months?
I think he's been doing very well. You know, he's I haven't seen any major changes.
If you take a history from the person and from someone who knows the person quite well, and there's a story of a gradually progressive memory impairment now affecting other areas of cognition, reading, writing, problem solving, and you also look at the general medical picture to see if there are other contributing factors, you put all that information together, one can be fairly accurate that you actually have a person who might be developing Alzheimer's disease.
In addition to the interview, patients will have a physical exam and might have imaging tests, such as an MRI or CAT scan. Only after other medical factors are ruled out can the diagnosis be made.
Once a diagnosis of Alzheimer's disease is given, I'm afraid that many families think that the end is near, but in fact that's not the case. This is a disease that moves very slowly, and patients have many good days over the course of their illness, and the disease changes very slowly over time.
That's why every time Dwayne comes in for a checkup, he is asked to go through a series of simple tests to find out how the disease is progressing. When she looks back to the past, Leah Thompson is pretty sure both of her grandmothers had symptoms of Alzheimer's disease. They were never diagnosed, but her stepfather was. And by that time, Leah knew much more about what was happening.
It was mostly words and forgetting words and acting strange and not, and then he would get depressed about not remembering things and not being able to, organize his ideas and get the kind of things done that he wanted to get done. And, I found it really helpful to not correct him too much, not get too annoyed. I mean, once we realized it was Alzheimer's, it's not his fault,
Getting a diagnosis can help a family move forward in understanding and helping the patient and the caregivers.
With your right hand, I want you to go back and forth on your lap here, like this.
Of course, a diagnosis also opens the door to treatment.
There you can see the big tree that fell there, and then you can see down.
Art has had a long and varied career. A preacher's son and high school football star, he went east to the Naval Academy. Following his Navy service, he moved on to corporate life. Then, he and his son started a telecommunications company.
You can do anything that you want to accomplish if you use self-discipline.
Through it all, his wife Nancy has been at his side. They've known each other since Sunday school, and he vividly remembers when they got married.
1957.
What day?
January 1st, so I'd never forget.
But while he can remember the distant past easily, Art is finding recent events a little bit more difficult to hang on to.
I can remember long-term, but short-term, what did I do yesterday?
What did you have for dinner?
Yeah, or what did I have last night for dinner?
Art's doctor has been prescribing one of the medications designed to treat some of the symptoms of the disease.
Hello there. How are you?
Fine,
Good to
thank
see
you.
These medicines have an effect on behavior, have an effect on cognitive function. They may stabilize the cognitive function for a period of months or perhaps a year or more, and that's very important.
No medicines exist yet to reverse or prevent the progression of Alzheimer's disease. The medicines that do exist might delay the development of symptoms, but work best if they are started early.
Up, up, down, down.
Research continues to find new and better treatments for Alzheimer's disease. A patient can actually be a part of this process by asking if he or she is a candidate for a clinical trial.
Clinical trials are the way that we in medicine determine whether a therapy works or not. Studies usually last anywhere from 6 months to 18 months, and there are frequent visits that the patient and a caregiver would go through to test the effectiveness of the therapy and also to keep track of safety issues.
Because trials often involve comparing a treatment to an inactive medication, there is no guarantee that a patient in a clinical trial will receive the experimental drug. But the care and attention that a person can receive by being part of a trial may be helpful. In addition to talking with your healthcare provider, you could consult the U.S. government's website for ongoing clinical trials at clinicaltrials.gov, or go to the American Academy of Neurology's website at aan.com/patients and click on Alzheimer's disease. Maintaining a good quality of life is a goal for all of us. It's not only good for people with Alzheimer's disease, but for caregivers who could be facing health issues as well. Research suggests that keeping your heart and blood vessels healthy may help lower the risk of Alzheimer's disease. So it's important to control high blood pressure, reduce high cholesterol levels, avoid smoking, and keep type 2 diabetes well managed.
Still got the yard to mow and
Absolutely.
trees to cut.
All those activities need to be done.
Exercise not only helps you manage your overall health, even moderate levels of activity are associated with a lower risk of Alzheimer's disease.
There are many reasons to believe that physical exercise is good because it will keep weight down, it will improve heart health. If it improves heart health, it should improve brain health.
83 points.
Okay.
We certainly recommend that people remain active intellectually, to remain involved in reading, going to movies, to theater, discussing current events, staying active with your family, staying socially connected with your family may actually be useful at preventing cognitive decline in the development of Alzheimer's disease.
Do some math that you don't want to do, learn a language. And, it's great for me as an actress because I'm always having to learn all these lines and things and different words that I wouldn't use. But I play Scrabble with my mom, who's 83, and she's sharp as a tack. She really is. She could still beat me, you know, and she's always learning.
Oh, that's hot.
Support groups can be helpful for people with mild to moderate Alzheimer's disease. These groups can be especially important for caregivers.
Support groups were originally developed for caregivers. They gave caregivers a critical opportunity to talk with other people going through the same thing that they were. And they've been fabulously successful in helping people cope with the disease.
It's also important to do appropriate planning, because if we know that something is going to be evolving down the road, you might want to make some financial plans, some retirement plans, household plans, etc. And I think it's important to know that as soon as possible. Also to educate the family on what might be expected down the road.
As we have mentioned, there are many reasons early diagnosis can be helpful. If a patient has what's called mild cognitive impairment, they might seem fine to the outside world, but they still may be vulnerable and could benefit from treatment.
You can avoid making mistakes with medications, with financial issues, with a changing living situation. If you knew that a person was developing cognitive impairment, you might do things differently.
Duane spent a lifetime managing a livestock farm. It was hard work, but it was work he loved.
That's a full-time 24-hour, 365 days a year.
Duane was proud of his farm and of his family. He and his wife raised 3 children. One of them, Greg, is a physician. At first, neither Greg nor his siblings suspected their dad had Alzheimer's disease. Their mother had died suddenly, and they thought their father was distracted by grief.
The death of my mother was very traumatic for all of us, and certainly for Dad. And you know, for the first month or two, we felt that some of the difficulty with getting meals ready for himself, taking care of bills and things like that were just part of the trauma of losing his spouse of 49 years.
After being diagnosed with Alzheimer's, Duane started taking medication. His children checked in on him frequently, but they found they needed to step in and help with his finances.
One of the most difficult things that we dealt with was people on the phone that would call and want to sell him things over the phone. There would be door-to-door salesmen that would take advantage of him, and we'd find out after the fact when things would come in the mail.
Duane's children canceled his credit cards, but they had a harder time convincing banks not to reissue them.
And there were multiple times that credit cards would keep coming in the mail, and we would find out about that and would have to get rid of those as well.
Later on, the family decided it was time for a move. Duane agreed to go into assisted living, but only on a trial basis. Now, he's comfortable living in a setting where he feels safe and has company.
Our family's been fortunate in that our father has been very open to what healthcare providers and what the family has felt is best for him. But I certainly would suggest for other families that it is important to be upfront, to not try to talk behind their back or go around their back to get things done.
Art has multi-generational support as well. Having their grown children nearby is especially meaningful for Nancy. She's among the millions of people who bear the day-in, day-out stress of caring for someone with Alzheimer's disease or another form of dementia.
Caregiving is a very strenuous exercise, both emotionally and physically. And if caregivers aren't careful, they can run themselves into the ground.
Sometimes caregivers will get angry at the person with Alzheimer's disease. It's not their fault, they don't mean to do it intentionally, but it can be very stressful to live with a person who may not remember, who may not even appreciate all you're doing for them.
Caregivers have a higher risk for depression and illness than the general population. They need to talk to other family members and the doctor about how they're feeling.
The patient family can also turn to the Alzheimer's Association, which is a tremendous resource for information and educational material. Sometimes, depending on the situation of the family, a lawyer who knows something about elder law can also be helpful. In other places, county social workers, area agencies on aging can also be resources.
Don't isolate yourself. You know, reach out. There's lots of resources. There's lots of people to help you.
Communication with a person with Alzheimer's disease can require a sensitive approach. Speak slowly enough for the person to understand. Avoid talking about the person as if he or she weren't there. Turn off televisions or radios when you're talking to minimize distractions. And allow enough time for a response. Try not to interrupt.
When they're in the room, talk to them. Don't talk by them, don't talk about them. Even though they may not be able to relate to you, may not call you by name, don't ignore the person. Talk to them as if they were participating in the conversation and give them the respect that they're due.
Sometimes patients like to be part of conversations, they like to be part of the action, and other times they really can't tolerate lots of children running around or multiple conversations going on. So it's up to the family to adapt as they see the patient is most comfortable.
Leah Thompson found a gentle prompt could be helpful when her stepfather had trouble with names.
And I found humor to be really good, you know, just be like, oh no, it's me, it's Leah, you know what I mean? Not be like stern about it, because that just made him more upset and confused, you know. I think it was important for him to realize that we weren't mad at him because he couldn't remember, you know, it wasn't his fault. And I see that with a lot of people who have Alzheimer's, because I volunteer a lot, so I meet a lot of different people who are in different stages.
Good communication with the doctor is also vitally important. Be prepared so you can get the most from your visits.
Doctors are busy. You need to come in with a good list of what you want to ask them. And I find that doctors really appreciate that.
Here are some of the issues you might cover during doctor visits and in family discussions. Safety is a single word that covers a range of concerns, from managing finances to handling medications to making changes in the physical home environment.
It's important to look at the environment in which an Alzheimer's patient lives, because they may be susceptible to injury, to harm from seemingly innocuous objects in the house.
Ask for a checklist of items to handle around the home, such as removing locks from doors to prevent being locked in accidentally. And ask for help evaluating the important question of driving.
Driving is a really important issue in patients with Alzheimer's disease. It's something that the American Academy of Neurology has invested considerable effort in trying to define when a patient should stop driving. If a patient has more than mild dementia, they shouldn't be operating a motor vehicle.
Be aware of the patient's feelings about this loss of independence, but be safe. Your Department of Motor Vehicles might offer an objective point of view. So can your physician.
A physician should be the bad person, so to speak, in the relationship, taking it away from the family members.
You might also talk to your healthcare professional about sleep problems. But here's some general advice. Encourage exercise during the day and limit daytime napping. Schedule physically demanding activities such as bathing earlier in the day. Limit caffeine and try to keep bedtime constant each evening. After losing her stepfather, Leah Thompson is living with Alzheimer's disease in the family once again. This time, it's her father-in-law.
My mother-in-law's been married to him for 60 years. It's very, very hard, and she's old too. So it's really important to give support and to be there emotionally for them, the caregivers. And I really can't overstate that.
Art and Nancy are facing Alzheimer's disease together, with love and understanding.
I think each day something unfolds. And I can't tell you what's going to happen tomorrow. I can't tell you what's going to happen in a year from now. And I think you just have to live each day, one day at a time.
Right now, Art is enjoying life to the fullest, traveling around the world and to the far reaches of his property, where he once built a treehouse with his son.
You had your cousin along to help you pound nails, and I did the heavy lifting, and we got it up there 16 foot off the ground.
Dwayne's son Greg engages his father in a conversation about the family farm. The moments they share now are precious to both father and son.
Something that I learned from my dad was he always had a positive attitude, and even on the worst days, he could see the silver lining in the storms that would take out the crops. You know, we had tornadoes go through our property and do damage to the property, but I learned from him to always be positive and to look at the bright side of things.
Research indicates even people who are at the further stages of this disease can take comfort from the presence of a loved one.
So grabbing the hand, putting an arm around, giving them a hug, giving them a kiss is very meaningful to them.
Even if the patient can't remember the visit, they certainly experienced satisfaction at the time by seeing a familiar face and interacting, perhaps going over old stories again and again.
Just be loving. They get, you know, your general feeling, like the love is really important.
New treatments for Alzheimer's disease and new ways to diagnose it earlier are in development. For now, patients and their loved ones should be aware that medications are available that can help improve symptoms, moods, and behaviors that may develop. Your neurologist can help you find the way to live as fully as possible.